Hi, I'm Jonathan Burtman, the owner and creator of Amazing Charts. With all the information floating around and pushing us to adopt an EHR, it's often overwhelming and difficult to figure out how best to go about it. But it doesn't have to be. And over the next few minutes, let me show you some of the benefits of adopting an affordable EHR like Amazing Charts. In the end, I think we all want pretty much the same thing, and that's to practice good patient care, be compensated appropriately and well, and to have time to do the other things in life that we really want to do. You can use the navigator bar at the bottom of your screen to move more quickly or slowly through this presentation. Okay, let's start by opening Amazing Charts. We'll log in under our username and get started. The Amazing Charts desktop is where we can pull up patient records and navigate around the program. Here, for example, we've selected William Sapphire, a patient in our practice. Scheduling an appointment for him is as easy as dragging his name onto the schedule. Okay, let me show you a little bit around this window. At the top are the main navigator buttons. They should be fairly self-explanatory. For example, right now, we're looking at the schedule. This button opens your intra-office messaging, and to do reporting and searching, you click this button. Below the navigator buttons is the patient list. We just click the letter S in searching for Mr. Sapphire, and all patients whose last name begins with S now appear here. And below the patient list is your taskbar. It's using the buttons on this taskbar that you can do various things with the selected patient. Clicking the Rolodex image opens their demographics. The folder button opens their chart. Clicking the printer will print out a summary sheet, and the binoculars will let you search for the patient in the schedule. The red X allows you to inactivate them. Clicking on the down arrows beside each button opens other related tasks, which I'll show you now. Clicking on the print down arrow, for example, will show me various printing options that I can do on Mr. Sapphire's chart, such as printing out a note or a letter, or printing out the entire chart. Similarly, clicking on the Open Chart down arrow will let me open up various aspects of Mr. Sapphire's chart. So let's open his chart, and let me show you around a patient record. By default, when we pull a chart, we're looking at their last encounter. Mr. Sapphire is a 59-year-old man last seen 23 months ago by me. Just like a paper chart, an Amazing Chart contains all the fields you usually use and will need, such as HPI, review of systems, etc. We'll come back in a minute and talk more about these. And also like a paper chart, at the top of each Amazing Chart are tabs. You can click these tabs to navigate around the patient sections. Let's look at Mr. Sapphire's demographics. The demographic window holds patient demographics and insurance information. Very easy to import a patient photo here as well. The summary sheet window contains a listing of the patient's issues. It also has information on how much of the practice resources this patient is using. The Past Encounters tab holds a listing of all the encounters the patients had with the practice, including telephone messages and addenda. It's very easy to drill down on this list, say to look at just the patient's assessment and plans over time. The Imported Items window allows you to scan and import various paper items into the chart. And you can even control your scanner and other hardware from within the chart, such as Midmark's EKG, spirometer, and Holter machines. There is also an Account Information tab. Amazing Charts records billing information as your notes are signed, and this data is stored here. You can even print out a CMS 1500 form. Now that we've looked around the sections of a patient chart, let's go back to the most recent encounter and document a note. The patient's last encounter, or most recent encounter, is the stepping off point for today's note. We're seeing the note from 23 months ago, but as we document today's visit, the note is updated with today's date. The benefit of this progressive type of a note is that you don't have to redocument items that don't tend to change, such as their past family and social history. So now let me show you how you document those items that have in fact changed, such as their review of systems. There are really three ways you can document into Amazing Charts. You can type into the text box, but this isn't really very efficient. You can also use voice recognition software. Drag and Dictate, for example, works terrifically right out of the box. The third way is to use templates. Right-clicking your mouse in any text box in Amazing Charts opens your templates. Having right-clicked in the Review of Systems text box, our Review of System templates now opens up. Amazing Charts comes with over 100 templates, and it's very easy to add or edit your own. In addition, you can share templates with our online community. So now let me show you how this works. I ask Mr. Sapphire if he has any chest pain, shortness of breath, trouble breathing when he goes upstairs, etc. He says no, and I document the negative cardiac review of systems. How about any black tarry stool or bright red blood in your stool? Any changes in your bowels? No? Negative GI review of systems. All this text we're generating is being placed here, and clicking the Move to Location button will place it back in the Review of Systems text box where we came from. Just as easily as using a mouse, we could be using a tablet and stylus as well. So the text is back here in the Review of Systems box. Let me do this now in real time in documenting my exam. I see a lot of people with low back pain. Let's say I'm going to document a low back exam on Mr. Sapphire. So I go over to the Physical Exam text box and right-click. I'll double-click this time on the applicable template, namely my neuro low back exam, and the template text rapidly ends up back in the Physical Exam text box. Now I'll just change it based on today's findings. And that's all there is to documenting his exam. Amazing Charts also comes with a complete ICD-9 database, so we'll search for his diagnosis here and find the correct code. In Amazing Charts, ICD-9s are color-coded. In this way, you can be sure that your code is complete and has a higher chance of reimbursement by third-party insurers. Okay, we're looking for the diagnosis of backache. It's a good green complete code, so we'll use it. I've double-clicked on the diagnosis code, and now it's back here in the assessment box. It's also been automatically added to his problem list, which is also found on the summary sheet. Of course, I've discussed with Mr. Sapphire his backache and the expected course, and now I use templates to document what was said. I right-click in the assessment box and find the desired template. And, in anticipation of prescribing an NSAID, I'll use my med's NSAID template to document what I've told him. Okay, the template text ends up here and goes back into the chart when we click this button. And here it is. Alright, now I'm going to write a script by clicking the Prescriptions button. This opens our prescription window. Over here are the patient's active medications, and here's where we write our prescriptions. Amazing Charts knows the last 100 scripts I've written and quickly populates the fields as I begin to type. Amazing Charts also includes a complete medication database, and yes, there's a reason I'm prescribing Vioxx, which I'll demonstrate in a minute. First, though, I'll actually prescribe the Vioxx, and it's now over here in the print queue where it's ready for printing or faxing. Let me just show you what the prescription will look like when printed out or faxed. Here's the default format, but Amazing Charts comes with other formats as well as required by certain states. Amazing Charts also includes advanced search abilities, including our ad hoc search generator, where you select specific criteria and generate your own search statement. This becomes even more important as pay for performance becomes a reality. Amazing Charts also comes with a host of other terrific features. Let me show you some of these now. A complete CPT and ICD-9 code database that's easily searchable is included with Amazing Charts, as are CDC growth curves, a letter writer, registration window where you can run various utilities, set up practice preferences, and turn on interfaces to other third-party programs, even the ability to co-sign notes, say for mid-level providers. Here we're actually giving some feedback to the provider that isn't included in the medical record. It even contains the new CCR, or Continuity of Care Record. This and other features we've included as part of our software package exemplifies Amazing Charts' dedication to both interoperability and affordability. Amazing Charts is straightforward, intuitive, easy to use, and truly affordable. It's simple to adopt and can be up and running your office within a day. I'm John Bertman. Call us if you have questions, and welcome to Amazing Charts.